Bismillah ar-Rahman ar-Rahim. Restlessness, shortness of breath is a symptom that may be due to a very wide variety of the diseases affecting the cardiovascular and respiratory systems. It may also be a manifestation of metabolic acidosis, anemia, septicemia, or even anxiety. So briefly, causes of shortness of breath or what's called breathlessness may include cardiovascular causes, then pulmonary causes, and it may include or may be a manifestation of metabolic acidosis, or may be a manifestation of anemia, septicemia, or even an anxiety. Then history in case of restlessness. When we are dealing with a patient with restlessness, what we should ask about? We should ask about the following: the duration of the breathlessness, how long has the patient been breathless, how did it start, suddenly or gradually, what was the patient doing when it started, it occurs on lying down, running, walking, and so on. Is the condition of the breathlessness getting worse? What brings it on? What alleviates it? Posture, medication, or oxygen? Any orthopnea or paroxysmal nocturnal dyspnea should ask about accompanying symptoms such as chest pain, cough, palpitation, hemoptysis, and wheezes. What is your exercise tolerance? You should ask the patient, what is your exercise tolerance? What does the priest stop you doing? Then you should ask about the past medical history. Have there been any previous episodes? Should ask about any history of any cardiovascular respiratory disease, especially heart failure. Should ask about respiratory disease such as asthma, COPD, or pulmonary embolism. Should ask about potential causes of acidosis such as diabetic ketoacidosis, renal failure. Should ask about any allergies, and does the patient smoke? Drug history, what treatments have the patients taken, and any exposure to drugs with respiratory side effects such as amiodarone and pulmonary fibrosis, any use of oxygen and nebulizer or inhalers. Then we should ask about social history. How have the businesses interfered with any activities, and what the patients do that what can the patient to do that the patient would like to do? Have there been any occupational exposures such as pneumoconiosis?